Tres.
Hello guys, my name is Daniel Pardo Hernandez. This is my video checkup for the head to toe physical assessment. This is the photo release form for Juan. He is sitting right here. I'm gonna do the 360 scan of the room. She's the person holding the camera. One. All right. So now I have washed my hands, I put some gloves, and now I'm going to address the patient. Good morning, Juan. How are you?
Fine.
Can you tell me your full name and date of birth?
Juan Pardo, on January 20th, 1972.
Okay. So the reason I'm here is because we're gonna do a physical assessment, a complete physical assessment from head to toe. Hope that's okay with you.
Yeah, it's okay.
Okay, thank you. So the first thing I'm gonna notice is the patient's facial expression. He has a neutral facial expression. Then his clothes and hygiene, as we can see, he is dressed appropriately. He is at his own home. He is clean, and I don't see any holes or damage to his clothes. So if you don't mind, I'm going to ask you a series of questions.
Yeah.
Okay, do you know where you are?
Yeah, at home.
Okay, do you know what time it is approximately?
It's around midday.
Okay, and do you know why I'm here?
For physical assessment.
Okay, excellent. So we can see the patient's speech is clear. He has an accent, he has a 4-inch accent. And do you have any pain right now, sir?
No.
Okay, do you mind if I take your radial pulse? Thank you. Okay, so the patient's pulse is 56 beats per minute. It is regular. It is strong and elastic. I would rate it as +2. Also, the patient was taking about 16 breaths per minute. These were regular and 2 inches in depth. Okay, so now if you don't mind, I'm going to take your blood pressure. If this patient were a female, I would ask for a history of mastectomy or any recent procedure involving her breast, because that would cause inflammation on the lymph nodes surrounding the breast and the arm, and it would not be advisable to take the blood pressure there. So I would do it in the opposite arm. Okay, the patient's blood pressure is 110/70. It's away. Okay, and now I'm going to examine the patient's head. So we can see the color is brown and even throughout the face. The patient does not have any hair, but the hair follicles are between the temporal lobes and the occipital. Examine the patient's facial features. The nose is midline, the eyes are aligned, So are the eyebrows and the ears, and the mouth is aligned as well. Can you raise your eyebrows? Okay. In movement, we can see that the patient's eyebrows are aligned as well. And can you smile? And as we can see, the smile is also symmetrical. So now I'm gonna take a look at your eyes, if you don't mind. Can you look straight ahead for me? Straight ahead. So the patient's pupils, the left pupil is about 3 millimeters, and so is the left one. They are equal and they are round. So now I'm going to assess the reaction to light. So I'm going to place my hand in between your eyes, and I need you to look straight ahead while I shine a light on your eyes. Is that okay?
Good.
All right. So look straight ahead. One more time. Okay, let's look straight ahead. Okay, as we can see, the patient's pupils constricted every time they were shined with the light. And now I'm going to assess for accommodation. Sir, I need you to follow the tip of my pen only with your eyes. Okay, so we saw the patient's eyes follow the tip of the pen every time. So now I'm gonna take a look at your arms. All right, so first thing I'm gonna notice, the arms are equal on size. The color is also equal on both arms. The patient has hair on both arms, I would say equally. Lesions, there are a couple of secondary lesions right here in the form of scars, and there's a primary lesion right here in the form of a mole. Okay, do you have any pain?
No.
What about here? No pain or tenderness? What about this one? Any pain, tenderness? I do not see any signs of edema. And the temperature is warm. This one. Thank you. Okay, so now I'm going to take a look at the patient's chest. Can you erase your t-shirt for me? Okay, so the first thing I'm going to notice is the chest color. It is a lighter brown, and the patient has hair and some primary lesions in the form of moles, so we can observe here. Okay, so now, sir, if you allow me, I am going to listen to your lung sounds. Take a deep breath every time I place the stethoscope. Set up away. Okay, so now we're gonna do the same thing but from your back. I'm gonna give you this chair so you can sit down. Can you raise your shirt for me? Thank you. Take a deep breath. Okay, so the patient's lungs sound clear bilaterally throughout all the fields, anteriorly and posteriorly. So now I'm gonna listen to your heart sounds. This is gonna be from your chest, so I'm gonna need you to raise your shirt one more time. Okay, so the first one, the aortic area, which is on the right side, second intercostal space. Right here. Then the pulmonic, second intercostal space, left side. And the Arab's point, third intercostal space, left side. Then the tricuspid, fourth intercostal space, left side. And the mitral, fifth intercostal space, left side. Okay, so I heard S1 and S2 normally, no S3 or S4 sounds were heard. Okay, sir, so now I'm gonna ask you to lay here on the bed. Oh, you got it. All right, you can lay down. I'm going to ask you to expose only your belly. You can cover your chest, that's fine. Thank you. So the first thing you want to notice is the color. The color is even, it's a light brown color. The patient has hair on the abdominal area and some primary lesions in the form of moles, so we can observe, such as this ones. Okay, and the abdomen's patient is symmetric, so we can see the umbilicus is midline with the body. And looking at the abdomen from the side, I can see that it is flat. So, sir, are you experiencing any pain right now?
No.
Okay, so if the patient had any pain, I would start to palpate in the quadrant where he's feeling pain. So if you allow me, I'm going to palpate your abdomen.
Yeah.
So I'm going to start at the right upper quadrant and then move clockwise. Any pain, any tenderness? Okay, as I was palpating the patient, I was also watching the patient's face or body for signs of guarding, and he had none. So now I'm going to listen to your bowel movement, sir.
Oh.
Okay, the patient's bowels are active, and I heard about 7 to 8 bowel movements per minute, which is a normal finding. Okay, sir, you can cover your stomach now. Okay, so now we're gonna move down to the legs. First thing I'm gonna notice is the color, the hair, and lesions. The color is brown, a little bit darker than what we saw on the abdomen and chest. And as we can see, the patient has hair well distributed throughout the legs and equally on both sides. He has some secondary lesions. Sir, do you remember this scar?
Mm-hmm.
Okay. And some secondary lesions over here too. Okay, no primary lesions that I can see. Do you have any numbness or tingling?
No.
Okay. Can you flex your feet? Okay, the patient can. And I'm gonna palpate if that's okay. Any pain, any tenderness? No. Okay. So the legs are warm. I don't see any signs of edema, and the patient is not experiencing any pain or tenderness. So now I'm going to evaluate the patient's feet, looking for lesions. I don't see any. Okay, can you raise your feet? Patient's feet are a little bit dry. Okay, I don't see any lesions. So now I'm going to take your pulse, your posterior tibialis pulse first. Okay, so the pulse is regular. It is strong. I would grade it as +2. Now I'm going to do the dorsalis pedis. Okay, again, the dorsalis pedis pulse is a +2. It is strong and it is regular. So that concludes the physical assessment. I would also note if the patient had any IVs connected or oxygen source or any other electronic devices. So at this point, I would help the patient to reposition the patient for comfort, keep the personal items in reach, so the light call, side rails up ×2, and I would go and document my findings.